Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. The reason why I'm shooting this video is we have a gentleman here, we're gonna keep his name out, and he decided to have his face blurred. And I'm doing this video because he had some wrist discomfort, clicking in his wrist. And he was watching a video on I guess some wrist videos. I'm not sure if it was a physical therapist or a chiropractor, but the doctor or the host of the show or the video had mentioned to put his elbow down and grab his wrist, squeeze it, pull up, and twist. I just have a lot of opinions on, you really got to be careful about that, right? Because you may see 100 comments down there, oh my God, this feels amazing, but did that person have the same problem as you? I mean, there's just so much that can go wrong. There's so much that could go wrong. And for some people, it could be just fine. But that distraction and twisting motion is dangerous, right? You have your ulnar collateral ligament, you've got your radial collateral ligament in there, and you can sprain those ligaments. Those ligaments attach bone to bone. And when you damage a ligament, you're in more trouble because there's no blood supply to those ligaments. You don't want to tear ligaments and start twisting on your wrist, especially as a electrician where he needs his wrist. But he was doing it, I guess, maybe trying to avoid going to the doctor. You know, sometimes you just can't avoid that. It's one thing to do stretches. It's another thing to do exercises to strengthen your wrists and forearms. That's different, right? And yes, you can injure your wrist when you do stretches or when you exercise and strengthen your wrist. That's always going to be a factor. You know, you may injure it, you may make it worse, but the chances of that are much less likely. When you start going in there and manipulating your wrist and manipulating the joints and you're asking for trouble. That's what chiropractors do. We go to school for this. And not only do chiropractors go to school for 9 years, 9 years. So it's undergrad for 4 years of exercise physiology, biology background, whatever it may be. And then 4 to 5 years of chiropractic school. It's not a joke. So you really got to be careful when you start cracking and manipulating stuff. Don't do that. Don't do that. Okay, stretches, exercises are fine to do, but we're gonna leave it at that. Now, I don't know what video he watched. I'm not gonna criticize the doctor or the person who shot the video because I don't know in what context it was. I just want you guys to be careful when you're taking advice for any kind of condition that you think you might have. You know, and then also you're self-diagnosing yourself too, right? So the wrist moves, it supinates, so when you go and you start twisting it, you're changing the whole dynamic, not only of the wrist, now the elbow. So he's an electrician, he needs his elbow, he needs his wrist. The wrist is really the main problem, right behind the thumb. So we're gonna go through some muscle testing and just check the structures of the soft tissue, which I've already done. I don't think he has a strain of the ligaments. I think the ligaments are intact here and fine, but he's definitely got some weakness in the elbow joints, in both elbow joints. But that's not necessarily just because of what he did. He's an electrician. I mean, he's doing this and using his hands and wrists all day long. So that kind of goes par with that kind of job. So after testing him, I do feel like his carpal tunnel region is flat. So we're gonna open that carpal tunnel region up and adjust it. And just relax here. Now don't go do this at home. Don't do this on yourself. I can't do it on my own wrist, so you definitely can't do it on your own wrist. Again, don't do this at home. That's why on all my videos, there's a medical disclaimer that comes up on the videos, not to do this stuff on your own, not to diagnose yourself. If I show you stretches, exercises, those I'll tell you could do yourself. Don't do this. And just relax here. Okay. Got sweaty hands here today.
Yeah, I'm nervous.
Nothing to be nervous about. Okay, now we're going to adjust your elbow. Okay, go ahead. Now, what I'm going to do here is I'm going to test the ulnar and the radial head, which are two different bones that come into your elbow joint and then also come into your wrist joint as well, okay? And 1, 2, 3, and bring your hand back. 1, 2, 3, resist. Okay. And 1, 2, 3, resist. Do either of those hurt? Okay. Relax here. Now, most of your pain is right in here, correct?
Yeah, like right where that.
The thumb joint.
Mm-hmm.
Okay.
Yeah, exactly where you're pressing it.
Yeah, it's going to be a little bit painful here. So it's stiff. We have to adjust that probably a couple times. Now we're going to do some cold laser therapy to ease the swelling and the pain in the thumb and wrist. We didn't get a lot of motion from your thumb today. Sometimes you'll hear it go clunk right back into place.
Oh, you mean the thumb?
Yeah.
Is that a bad thing?
Is it what?
Is it a bad thing?
No. So cold laser therapy just helps to reduce all the inflammation around the thumb joint into the wrist, reduce the swelling, and if there's any kind of strain or sprain to tendons. In this situation, the ligaments are fine. They're intact. Of course, we haven't done an MRI. An MRI would be probably the best test if things don't improve for him. So we'll be keeping a close eye on him and if need be, get him an MRI. So again, folks, if you're watching videos on YouTube and you're desperate for help, just be really careful about what you're doing. If you think it might be dangerous, probably it is, and don't do it. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.